as the traffic clears. My name is Chris Vogel. I'm a member of the League of Women Voters of Marion Polk County. And we're delighted to be able to host this forum tonight on children at risk. And if you have been following legislative activities for the last 3 years, you know that a revised structure has been put in place that has created early learning hubs. And Marion County was the first county to receive a contract. That's because they worked fairly hard to get that. And we have 4 representatives today who are going to start with the basics, tell us a little bit about what used to be, what early learning hubs are, and what they hope to do in the future. And we will introduce people as they go along. We're going to start today with Janet Carlson. And Janet is one of the Marion County Commissioners.
So thank you all for coming tonight and for the opportunity to talk about early learning in Marion County. And I do have to say that all of these pictures that I have are of my 3 grandchildren at various stages. I use every opportunity I can to shamelessly put them in PowerPoint. So I do have permission from my daughter and my son to use them. So, overview of early learning. How did early learning come about? Well, we've talked about early childhood education. We're going to talk tonight about brain research. For a very long time, people know that those first formative years are really important for early childhood development. So Oregon really got focused on early learning with a transition team report that came out in February of 2011 during the legislative session. And I won't read the slides to you, but you can see what the vision was for that. Since the early, I'm thinking 1993, Oregon used local commissions on children and families as sort of the vehicle for looking at early childhood education and youth development. And so counties were responsible for those areas to coordinate. Dollars were sent from the state to counties to do that work. And so with the transition team report, there was sort of a reevaluation about whether that system was actually working the way that it was intended to work and whether or not it might be better to focus the dollars in a little bit of a different way. So after the transition team report was presented in that 2011 session, Senate Bill 909 passed, and that created the State Early Learning Council and kind of gave the idea that there would be early learning hubs. The next session, 2012, the short session, House Bill 4165 passed, which then added some more detail to how this system would roll out. And then in the 2013 session, House Bill 2013 passed. That actually established the early learning hubs and so that there would be 16 around the state. One of the things that I thought was very interesting about the transition team report is that it mentioned that the local commissions on children and families had not been able to demonstrate results. And what I tell people is that there was a lot of good work going on in counties for early childhood, a lot of relationships built, a lot of collaboration that occurred. What I think the problem was that there was no overarching system at the state level to say, let's collect our outcomes this way so that we can actually demonstrate results. So it wasn't that results weren't being created, it's just that we weren't able to show statewide how we were making progress. I've got a list up here of early learning services and early learning partners, because sometimes when you talk about early learning, people say, well, what are you talking about? What kind of services? We actually, Allison Kelly and myself, went to a meeting of school superintendents at the Education Service District. And after we got through making a very cogent presentation with using educational language, one of the superintendents raised his hand and said, so what early learning services are we talking about? So getting down to the basics, there are just a whole array of services that are available for families with young children, ranging from child welfare and children's mental health to relief nurseries to public health to early intervention and early childhood special education, and you can see everything in between. Early learning is supposed to encompass all of these different services. Childcare is one of the more interesting ones because the childcare system is not really a system. There are discrete childcare centers. There are people that do childcare in their home as a business. There are people that watch the child next door. There's grandma who watches the grandkids. So figuring out how to use childcare as a mechanism to improve early childhood development, I think, is one of the big challenges of this early learning system. The other side of the slide shows the early learning partners, so who's going to be involved. And it's everybody. It starts with parents and grandparents and families, but we need foundations. The Oregon Community Foundation, the Ford Family Foundation, others have been very interested in this topic and how they might contribute to worthy programs to move this forward, so it's not just about government. We have businesses that need to be involved, faith organizations, service clubs, and so on. And then for professional development, we really need to be looking at our community colleges, our universities, in terms of how are we training childcare workers and early learning program workers now, and how are we skilling up the people that are in the profession to be the best that they can be. So what are the characteristics of the families that we're looking at? And I just pulled a little bit of data from the application, and I know Margie's going to go into, I'm not pretending to be an expert on our current early learning hub, but we have roughly 32,000 children ages 0 to 6 in Marion County, and 76% of them are at risk. So when you look at the three focuses that were in the legislation, one was children in poverty, the second one they called children of color, which would include children that are limited English-speaking children or from families where English is not spoken. And then the phrase they used was children touched by publicly funded systems. So those would be children whose families are in the welfare system or children that are involved with services already. So what I think is most interesting to look at is if we have 32,000 children, look at in the current early learning programs how many that we're touching. So 101 children served in therapeutic classrooms, but, I'm sorry. All right. So anyway, 101 children served in therapeutic classrooms, and yet we have 76% of 32,000 at risk. So the capacity is very small, even though we have lots and lots of programs that do this work, and we have 19,000 and growing numbers that are enrolled in the Oregon Health Plan. Those subsidy programs don't necessarily work with the families on the skills that the children need in order to be ready for kindergarten, nor do many of those programs screen children so that they can get referred. So if the child has a learning disability or a hearing or vision problem that would interfere with them being ready for kindergarten and reading at 3rd grade, there's not a connection between those programs and some of the screening that's done. So that's one of the tasks of the Early Learning Hub, is to figure out those connections. So the next slide is about building a framework, and that's my grandson Brandon, who loves trains. We do trains all the time when I visit with him. So this was the framework that we worked on. We started work in Marion County on the transition in January of 2012. So when the session was over and we got the county commissioners together and said, how are we going to move forward? And then we spent a year and about 2 months working on the transition from the county to the early learning system. And I think that built a great foundation for the Early Learning Hub to put forward its application to do the work that it needed to do. So what we looked at was really 4 different elements. Early identification, so how do we identify early the children that need help? Referrals to services, so we have lots of services, but how do we connect those services up and do what they call a warm handoff? So in other words, if I'm referring, I don't just give you a phone number or say go over there, but there's a way that those services connect up so that you're more likely, if you're a family, to be able to access the service. The services themselves and the capacity issue that I talked about, and then the metrics are the results. So how do we measure success? So what was very interesting, we had a group that has been meeting for years and years, and its latest name was called Great Beginnings. It was the early childhood providers that met together. And so we sat down over the course of about 6 months and laid out various issues. And they're very good at identifying problems. We just complained about problems until you wouldn't believe it. And so finally, we got all the problems listed on flip charts, and we put them in charts with each issue. And then we said, okay, now let's talk about the resources that we have. So what can we build on? And then we had to move towards solutions. And so when we got to the solutions, they wanted to talk about the problems again. It's like, nope, they're all listed here. You can't talk about them anymore. We have to talk about how we move forward. And again, that laid the groundwork, I think, for the application for the Early Learning Hub. So then you need to actually start designing the system for coordinated service delivery. This is Brock. It can get a little messy. So this is what the system looked like in Oregon before these three bills. And I think that the state is making an effort now to kind of unscramble that. So monies come from different places. So for example, the Oregon Health Authority gives money to counties, the Department of Ed gives money to school districts, the Commission on Children and Families, which has been eliminated through the legislation, gave money to counties, the Department of Human Services. You start looking and trying to connect up the dots, and it all crisscrosses. So no wonder people get confused about who's in charge of what, and no wonder we have silos, and it's very difficult for us to organize these services. We presented this chart. We actually created an early learning task force that I chaired through the Association of Oregon Counties, and this was a slide that we presented to the Early Learning Council early on in their work, and they adopted a lot of our recommendations in their report, their initial report for Senate Bill 909. One of the things that came out in Senate Bill 909 that was really a foundational piece for the Early Learning Initiative is what they call family resource managers. And as they were introduced to the legislature, they were very insistent, the speakers, and that was Pam Curtis and Lynn Saxton, that these are not case managers. We're not looking at the traditional idea of having a worker that has 100 files in a drawer and you fill out a form and you're one of those files. This is a person that really works with families short term, connects those families to resources, helps implement that warm handoff approach, and helps make sure that when children and families are referred to services, that those are the services that they need. So people ask me what's different about this early learning initiative from where we've been before, because we've tried a lot of things. Is this the new math? Is this something that's going to really work? I think there are several things that are different. One is that we just know so much more today than they knew even in the 1990s when we were working on the Commission on Children and Families. We have what we call research-based or evidence-based practices, and everyone that's working in the field is becoming more aware of what those are. So it's not like we're making it up as we go along. We have research to tell us if we do things in a certain way, we will be more likely to get results. The second is system alignment, and I've talked about this all the way through. So childcare, schools, healthcare, human services, we need to get everybody lined up so that they're all moving in the same direction. The third is professional development. It's so important that we have skilled workers. And it's tough because the pay scale for childcare and for early childhood programs is not that wonderful. And so to attract people to this system that will be able to have the skills to get the results that we want, I think is going to be key. The fourth one is coordinated screening and referrals, and I think this is really where the Early Learning Hub is beginning. That there was a request that they made to the Coordinated Care Organization, and I really haven't talked much about that at all, but I serve on the board of Willamette Valley Community Health, and this is the group that's trying to coordinate just health care and mental health care and dental for families who are on the Oregon Health Plan. And so there is some transformation money that Coordinated Care Organization has provided through a grant to the Early Learning Hub to work on screenings. And then the last is business and community engagement. We cannot solve this problem just by having the professional government people or the professional nonprofit people or the professional school people do this work. It's something that parents have to be involved in, that the community has to be involved in, business and faith organizations need to be involved in as well. So my last slide is that there are 3 outcomes that are prescribed by the state. They're fairly broad outcomes. One is that children are ready for kindergarten, and there is a new kindergarten assessment that I'm sure Chuck will talk about when we get to his turn. I've just given some examples of things that they look at in these various outcomes. Families are stable and attached, and then the last one is that services are coordinated and effective. And I know we're going to take questions at the tail end, so we'll bring that slide back when we're all done. So thank you. That's for the radio, so you need to put that close to you.
And Chuck, you've traveled all the way from Woodburn today to be with us. I appreciate that very much. Tell us how early learning connects with school districts.
Well, thank you, Janet, for the very nice overview. I think you captured a lot of key points, and I can just go ahead and jump right in where you touched on things that affect schools. I think I had to turn and look at that one slide that showed the various what we refer to as silos, and those arrows trying to line up, trying to connect. wouldn't it be a beautiful world if we could just picture the birth to career continuum and have all those arrows just following those children as they moved along? But that's not how we're set up. Oddly enough, that's how we're set up as families, though. That's how we think about our own kids. We think of them on a birth to adulthood continuum, and then we wait joyfully for grandchildren, which I don't have yet. I want. I will share a little bit about what's going on in schools, but I'll do it through the lens of Woodburn School District. We share a lot of what's going on in school districts across the state and across the county, but we have some things that are particularly unique to Woodburn. We discovered early on, largely through our demographics, that we needed to support with great intensity early childhood development, but particularly early childhood literacy. Originally in Woodburn, and we have a very high poverty rate in our catchment area. Almost 80% of our students come in qualifying for services for poverty. And we have a very high percentage of kids whose language is not English when they start school. Those two pieces, they come together and put pressure on districts to help those kids perform well by third grade that are truly challenging. So when we first went at it, we said, all right, let's start doing some research. Let's start digging into this literacy piece. And almost 14 years ago, we landed on the strategy of a dual language literacy development program. There are other districts who are doing this. In fact, most of them who are doing it came to that conclusion after Woodburn. But the theory is a little bit, it could be a little bit, cause some cognitive dissonance, but so bear with me. The idea is that literacy is not a function of language, it's a cognitive process. And if you learn the fundamentals of literacy, and I think our brain research specialist will tell us what those are, if you learn such as letter recognition, sight sound recognition, in any language, once that becomes a cognitive ability, once it becomes a proficiency, it's a proficiency regardless of language. Later in life, when you learn a second language, those proficiencies transfer to your language. For example, if I came to you having been educated as a brain surgeon in Brazil, and I didn't speak any English, only Portuguese, when I learned English, I wouldn't have to learn to read, write, brain surgery all over again. I would know those things. I would simply learn English and I would be okay. So think of children in that context, and you'll see where we landed. If you emphasize acquisition of English, especially at an early age, we're talking ages 5, 6, if you emphasize acquisition of English before you develop literacy, you're essentially pausing cognitive development for that child, and you're waiting for them to have enough English so that input that we give them in the classroom is comprehensible, and then the literacy development can take off. So you end up with a delay. Now, if you can't provide literacy development in the student's first language, that's a problem, and it is a problem for districts who have students who have unusual languages or languages they can't support with their staff or programs. But in Woodburn, the case is that the language that dominates is Spanish. That's the language that kids come to school with as a first language. So we went after literacy development in a dual language program where we did early literacy development in Spanish alongside our English as a second language program, and we've seen tremendous results in that kids develop literacy and they're proficient in English usually by around 5th or 6th grade. Nonetheless, so because of this program, we began assessing kids for the purpose of placing them in the correct kindergarten program. So we needed to know about their language, what was their first language, how good were they at their first language. And so we created what was called a welcome center. Rather than have students and families register their kindergartners at their neighborhood school, we had them come to a district center where we could register them and give them a language assessment. And what we discovered, it's called a pre-loss. It's on a scale of 1 to 4, and the lowest score is a 1 because 0 is not possible. So 1 is the lowest score, and we were getting a lot of what we would call pre-literate or 1-1s, kids whose first language was in fact Spanish, and they scored a 1. Right? They weren't very pre-literate. They weren't literate in their first language. And of course, their English, also a 1. 1-1. So we knew we had not a language issue, but a childhood development and literacy issue. And our first strategy was to go ahead and at the district's expense, and this is an important point, this will be coming up, at the district's expense, we decided to fund full-day kindergarten because previously we were half-day. So we said, well, we need the kids to be here more because we've got some catching up to do. So we funded full-day kindergarten. Now in the state of Oregon, if you don't know, compulsory attendance does not begin in the state of Oregon until age 6. So parents, if they choose not to, they don't have to start until age 6, but most parents choose to send their kids to kindergarten by age 5 because, thank goodness we kindergarten. But the state has not funded full-day kindergarten, right? But that's going to change. So coming up in the 15-16 budget, the state school fund, K-12 school fund, will fund full-day kindergarten for the first time. We're very excited about that. But in Woodburn, we've been doing it for over 8 years. So we've got these kids, they're in their full-day kindergarten, and we're trying to get them to catch up, and we're seeing that we have these literacy issues, but we're also beginning to see that the literacy issues, and I'll let you cover this, the literacy issues are also tied to those development issues. Because those of us who've watched our children grow, they don't cooperate with us. They don't just suddenly turn 5 and become ready for kindergarten. Sometimes they're ready sooner, sometimes they're ready later, and obviously the work we're doing here, we know there are things we can do at ages 2, 3, 4, 5 that are really good for kids that help them prepare for their lives as learners and developing literacy. So we obviously, as superintendent, if I had it to do over again, would I recommend instead of full-day kindergarten, would I have recommended a half day of pre-K and a half day of kinder and stretch that at half days for over 2 years? Maybe. I didn't know what I know now. But the hub gives us an exciting chance to do both, I think, so we're looking forward to that. Along with the state's decision to have compulsory school begin at age 6, we're also in an era of accountability. So most of you have heard, or people are aware of the No Child Left Behind Act, which launched an era of testing at all levels to track progress of learning, but primarily to hold districts accountable. So school districts needed a mechanism to judge their program, hold them accountable for getting results. And the first score that's significant under that law, which is now 2014, because the goal, it came to be in 2001. Its goal was to have 100% of kids at grade level in all grades by 2014, and we're here. So we didn't make it, by the way, but we're here, and so that law that we started testing. So we had the 3rd grade reading scores. We began to look at 3rd grade reading scores. We've been looking at those for a long time, and we're trying to move on that. But with accountability, you have to be careful, because what schools do and the accountability measures don't do is schools are trying to graduate students along a continuum K-12, and the 3rd grade reading score is really a predictor. It's a predictor of if the kid's reading on level in 3rd grade, is that predicting that the kid will be successful, graduate, and go on to career. So the difference between those early accountability measures with NCLB and the new accountability measure, which we have now, which is based on the waiver that Oregon has from the federal government, is essentially using those same assessments, but we've added a new component. As a state, Governor Kitzhaber has introduced the 40-40-20 initiative, 40-40-20, by the year 2025. And what that represents is that by the year 2025, 100% of students will graduate from high school. 20 of those will be essentially career ready at graduation. 40% will go on to a post-secondary training of some kind, and 40% will go on to a university. Very ambitious goal and aspirational. I think it's attainable. But if we're looking at that goal, as the governor has asked us to do, to look at it in a continuum, he said, stop looking at it as a silo. Quit looking at it. You get them at kindergarten, you graduate them at 12. Start looking at your kids from the moment they come into your community and beyond the time they leave. So start thinking of your system as a pre-K grade 20 system. And so that's what we've been asked to do. And I think that's a big shift, and I think that's complementing the work we're doing here with the hub. This group here, this panel is focused on that early end. So the accountability, as you might have imagined, in the area of accountability, there had to be an assessment to hold us accountable. And actually, all kidding aside, there has to be a way for us to judge our programs. So Janet mentioned the kindergarten readiness assessment, and this is giving us data for the first time in the state about where kids are when they come to us. So we're able to, we assessed all kindergarten students for the first time coming in the door this year. And I think Marty had some data on that she'll discuss. So yes, the instrument has some issues and we'll work on it over time, but it's good that we know this. It's good that we know where kids are when they're coming to us, because that's how we begin. The results were sobering, I can tell you, and we know we have some work to do. The work, from the school district perspective, as Janet mentioned, sort of bringing those things together. So what a district can bring, I think, is some real articulation in the area of curriculum and instruction. And we do know quite a bit about assessment. So by bringing us into the discussion with our partners in pre-K, especially our Head Start partners and private providers, we can actually talk about what are the good things to do in early literacy, and start having those discussions. We can also start integrating the kindergarten and pre-kindergarten experience with the new standards. And we already are very involved with our parents in our community in the school district, but we haven't ever said, well, let's get involved with them specifically about their kids before they even come to us. That's something we do, but we can do it differently. We can do it better. So I think we can bring that to the table, and we're excited about being able to partner, and I speak for all districts. And finally, we're really after an outcome in Woodburn School District. Our outcome is to guarantee that all students, especially 4-year-olds, have access to a quality preschool experience and come to kindergarten as ready to learn as we can do it. And that's going to be a partnership. The district's going to participate. Probably means some pre-K classrooms funded by the district. It means stronger partnerships with our Head Start providers and our private providers. But that's the goal. We need more kids having that quality experience. Right now, about 60% of our kids coming into kindergarten are well below the level we'd like to see. And at Woodburn, they were talking about 500 kids, and that's a lot. So that's the challenge before us, and I won't take up any more time. So, thanks, Dan.
Not only is Verinda here today to tell us about children's mental health, she may have stretched her own mental health a slight bit because she found out she was doing this presentation yesterday and has already put together a lovely PowerPoint. I think that you'll tell us why mental health is so important to early learning.
So I'm Viridiana Pozos, and I'm a counselor with Marion County Children's Behavioral Health. Okay. And I'm here today to just talk about Marion County's involvement with the Early Learning Hub. And as you can see on the slide, there are the different ways that Marion County is involved with the Early Learning Hub, and I'm not going to read through all of those. And I'm very excited to be here to share how mental health ties in with the Early Learning Hub. I am a counselor for children 3 to 18. That's what I started, but I'm seeing in my work that I've gone earlier than that, as early as babies that are just born. And it's just very fascinating to see the work that we do and how it just all ties in, and how we are getting those children, preparing them for school and their families. Early childhood mental health interventions that we do to help with that is provide parent education. There's a lot of different programs that we offered at our agencies and in the community. Parent education is one of those, and there's different kinds of parent educations. Circle of Security, which teaches parents how to promote and help their child reach that circle of security so that they're able to go and explore their surroundings. If that circle is broken, that child is less likely to thrive and to go and explore that environment that they're going to grow into. And then we have the Nurturing Parent, which is also similar in the sense that provides parents with tools on how to promote healthy relationship with their children. We have didactic therapies, which is therapies that parents and their children participate in. These are different than the parent classes that are offered, in the sense that in these two different therapies, parent-child attunement therapy and parent-child interaction therapy, we, the counselors, coach the parents directly right there in the moment. We provide them information, and then we're guiding them step by step in different skills, different ways for them to interact with their children. Play has been found in research that's very important for children to learn different skills, emotion regulation, cognitive skills, and just different skills that are just going to help them in their later life. So recess at school, very important for children because that's their time for learning. We use play as a main tool in therapies. A lot of parents in the community don't know how to play with their children. And it is very crucial that they spend that time playing with them, because a lot of skill building is learned through play. And so through that play, that's how we help them out. They communicate better with their children through those therapies. They learn how to listen to their children. Children learn just basic things of how to follow rules, how to organize their ideas through the play, which leads on to the classroom. Through all of these interactions that the children are going, their brain is developing. And we're talking about, in the previous speaker, about how literacy or poverty, how that affects. We have a lot of children that are in the foster care system that grow up with neglect, trauma in their lives, and that has a very big impact on the brain. And a lot of parents believe that because their children are young, it doesn't have an impact on them. But research has shown that everything that happens in the environment is affecting the child since they're in the utero. And so it's very important to provide that education to the parents from the time they're pregnant. It's very, very crucial. There's a lot of research that shows how much the parent takes care of themselves and makes sure that they're not living in chaotic, stressful situations during that pregnancy will lead into the brain already developing healthy. When we put other factors as neglect, trauma, and other very strong experiences, the brain, it really has a big impact. And so through these therapies, we're helping rewiring some of those rules that the brain has already developed in their brain from just early experiences to help them reach their optimum when just in their everyday learning. We have individual and family therapy that helps address a lot of the family factors, environments that can happen. A lot of the issues can be generational. Some of them are, they can be temporarily just some traumatic experience. And we want to help out these families, not just the individual, but just looking at a whole systems approach that it affects everyone. And a lot of times, these children are showing different symptoms that we could totally diagnose, but they are product of things that are happening in the environment that could be fixed. For example, more playtime, more one-on-one time with their parent, and just giving that child more structure. Having a routine and structure in the homes helps children to be more organized and to feel more secure. And so that helps them when they go and venture out at 4 and 5, when they start going into preschool or kindergarten, helps them to feel secure in the classroom, to be able to pay attention, to process everything that's going on. And so as an early childhood counselor, we promote a lot of those positive interactions between the children and their caregivers, because it's a stepping stone for what's coming on in their later years at school and in their lives, making better decisions. And one of the newest services that I've personally provide to families is infant massage. Touch is very important to the child, a good physical touch. A lot of these children come from homes that do not receive any touch, or the touch that they receive is hurtful. And just by a simple touch, a lot of good endorphins are released into the system, and this helps the children to thrive in so many different levels. So just even providing parents with that psychoeducation, and so I'm seeing caregivers with newborn babies up to 12 months and teaching them what is good physical touch. And then even then with babies, how to learn how to read the baby's cues, and to learn that babies are communicating with the caregiver, and teaching parents communicate back. And it helps the caregiver stress decrease, and the baby's stress also decrease. If a caregiver is feeling frustrated, is feeling stressful, overwhelmed, it's being projected onto the child, and so the child is taking all of that. And that's why we have a lot of children in the classrooms that are also anxious, because a lot of it could be projected from their caregivers. And so when they're anxious and they're in the classrooms, they're not concentrating. Their brain is somewhere else. And so they're not able to retain the information that's coming to them. And so we want to help these children to feel secure, to feel confident, to go into the classrooms and to be ready to learn. And with the children that have experienced a lot of different traumas and neglect is the one that's more hurtful to the child, we want to be able to help them out in rewiring their brain. And so it's really important that we provide that information to just the community, doing a lot of speaking, because we do want to increase the parent-child attunement and nurturing that happens, decrease child and parent negative behaviors and patterns, and improve parent-child enjoyment of each other, because that's going to help them in the classrooms and just in life. and enhance child's compliance with expectations of the parents and expectations at school. When they have that gotten down, then they're able to learn. And so I've already touched a lot of these, but how does mental health tie into the school? Just being able to build a learning relationship with adults, with their teachers. Social emotional needs are being met, and secure attachments lead to explorations of their new environments. And there's a lot of work that needs to be done to accomplish that. And that's just a picture of the brain diagram. And so we start from the brain stem, and we want to help support of that, because if we meet the basic needs, which are the beginning, then they're able to reach the more abstract and more complex that are on the top, which is where concrete that thoughts and everything goes out. So if we miss one spot at the bottom, we need to go back and make sure we fill those in. So brain development is very important, and we all here can do something to help with promoting healthy brain development.
So Margie, Chuck set you up quite well. We are in the age of accountability. You are the numbers person. So tell us, as the Chief Performance Officer, what are you following, and how are you tracking this?
First off, I want to thank everyone for being here this evening. I recognize several familiar faces in the audience, and really thank you for your interest in the well-being of particularly young children in Marion County. And I also want to thank Commissioner Carlson for her leadership in helping the Hub get off to a really wonderful start. You built us a wonderful foundation, and the work of our partners has been really phenomenal. Every day we come to work and we look at new opportunities to find ways to be more effective together. And that's really what the purpose of the Hub is. This morning I had a chance to attend the first state convening of the first 6 hubs. Marion County was the first. There are 5 who are about to have contracts right behind us. Multnomah County, Yamhill County, Lane County, and then some counties in southern and eastern Oregon as well. And the governor came in briefly to chat with us, and he said, you know, we're really engaged in new work, but it's based on a lot of the work that went before us, and we're really trying to build on the most effective parts of that. And we're moving into some new territory with new information, but as the governor said this morning, that's the part of the maps that the old cartographers used to write, there be dragons there. So we look forward to your helping us find and identify maybe some friendly dragons, and to slay those that are perhaps more scary to our children. In Marion County, one of the things we had to do as a part of our plan was to put together a comprehensive children's budget. What are all the resources that are being spent on behalf of children in our community? And it's over $120 million. And you know, we all think of that as like, well, gosh, we ought to be able to work miracles with that much funding. And there are people who literally every day are working miracles on behalf of children. But unfortunately, not all of them are benefiting as much as what they need, so that when they arrive at Chuck's schools or other schools in our community, that they can really benefit as much as possible from the learning opportunities. That's important to them, but it's also important to all of us. I mean, these are the people who are going to be our future workforce. We want to make sure that they're going to be as capable as possible, so that they can be the future counselors, school superintendents, county commissioners, brain surgeons, and League of Women Voter members. So as we've really embarked on this work, we, in our plan, actually set aside a portion of our funds that we expected to receive from the state, and said it would be premature for us to say how we were going to use those resources, because we don't yet know what the outcome is of the kindergarten assessment. This is a brand new tool. And yes, with every new tool, there's definitely a learning curve to figure out, you know, what's the right way in which to apply this, what are the most effective uses of the information that we're going to glean from that, and how can we improve because of that. And the information that I think was shared with you actually is a synthesis of that information. And on the side of the paper that's got lots and lots of elementary schools, this is every elementary school in Marion County with what their kindergarten assessment data included. And it doesn't actually give their scores. If you go to the State Department of Education's website, you can look at every elementary school in the state and look at what their kindergarten assessment schools are. So if you want to look at your own particular neighborhood, you can see their specific data. But they measured 4 things. 1, approaches to learning. 2, letter names. 3, letter sounds. And 4, early math skills. And these are all things that were selected by a panel of educators that included both local and state educators as key indicators that they know lead to higher likelihood of success in 3rd grade, which is that first key benchmark that Chuck was mentioning earlier. And we had some fairly daunting scores, and we're like, okay, what's the right way in which to use this? In our plan that we had approved in our contract with the state, we had said we were going to target our highest need elementary school catchment areas for services. And this was really our best way in which to gauge that. So we took this information and we said, the state didn't really establish cut marks. You know, there isn't really a point where it's this child's kindergarten ready and this one is not. That's not the case, and that's not how we're going to use the data. But we said, we know that we have some students in some schools who are struggling more than others. And so we said, well, let's take the schools that were in the most challenged 25 for each one of the 4 measures, and then just see how many occurrences they had across. And so if it was an elementary school that their children struggled in all 4 measures, we said that's obviously a very high need community where we need to figure out new strategies. And then we added to that the eligibility in those same schools for free lunch, and also the percent of the students that they served who are identified as minority, 2 other important indicators. And as you can see, the schools that had the greatest challenges and also the highest poverty were really very much the same. And to all of us, that really points out a huge challenge. These children come from families that are struggling with a lot of issues, and their learning is one part of that, but it's one part of that, not the whole question. So we then worked with our superintendents and other members of our board to identify how, from this information, what's the right way in which to target our limited resources. And we initially had a list of almost 25 elementary school catchment areas, and the superintendent said, we don't have enough bandwidth in order to cover that much territory at the beginning. And so we narrowed that list to the 15 elementary schools that you see on the other side of the paper. And this gives you information about how many kindergarten students they have, and so you can see quite a range of different school sizes. You also can see how often they had occurrences in terms of their kindergarten scores being in the lowest 25 elementary schools, their diversity and their poverty information, as well as their 3rd grade reading. But in addition to that, we also have some really great partners who are working on behalf of these students in other places. Salem Keizer School District has what's called a P3 grant from the Oregon Community Foundation that's targeting services for 5 of these elementary schools already. The Woodburn schools have been doing some wonderful work with the Catholic Community Services in a program called Fostering Hope. And some of these schools are also getting additional resources in the state school improvement program in order to help them boost student progress. So we want to build on top of these initiatives and not to replicate them, but to take their efforts to scale, to serve more students more effectively. So that's a part of our strategy. We've actually submitted a grant that's asking for some supplemental resources from the state to even do a better job of improving those services, but we will not know where we're at with the funds for that until the latter part of May. And at that meeting I was at this morning, I asked, what's the competition look like for that? Because, I'm trying to figure out how far can I go with our limited resources, and if we don't win that grant, should we serve fewer schools, or should we thin the soup and not provide as many services but still try to cover as much geography as what we can with the dollars that we have? There's 40 applicants for those grant funds, and people were not limited to how much they could seek to use for that. So I would say we're probably only 50-50 in terms of whether we're going to receive those funds. So we're going to be looking to all of our partners and to the folks in our community, and great people who can help us marshal volunteers and other efforts to carry this as far as we can go in as many ways as what we can, and also to reshape where we can that $120 million that's already being spent in our community. On the accountability side, we had to agree to certain key metrics with the state, and so we've done that in key areas. One, how far we can improve kindergarten assessment scores, and because this is a brand new measure, we've been very cautious around that, because we don't really know how much any particular endeavor can move the dial. We're looking at doing things in partnership with other services that are already touching these children. For example, we are co-housed with the community, the Coordinated Care Organization, and they're willing to do mailers to all of the Oregon Health Plan children in the family's first language. So we're looking at developing a kindergarten-ready toolkit that we can mail to families in their language, so that it gives them more advanced information of activities and things that their children could benefit from knowing, and with strategies. And one of the exciting things we learned this morning is that by action of the Early Learning Council just today, we have been awarded a $100,000 grant for early literacy, where we're partnering with the Marion County Medical Foundation to do a literacy outreach program in at least 10 of the largest pediatric clinics or general practitioner clinics that serve Oregon Health Plan children, so that at every well child check between 6 months and the child's 5th birthday, the child will receive a free book, and the parent will receive coaching on how to do effective reading aloud with the child. And 90% of our children who are on the Oregon Health Plan are served in those 10 clinics. Now, those clinics won't do the book distribution with only the Oregon Health Plan children. They'll be doing that book distribution with all of the children who come through those doors for services. So if you've got grandchildren or children that you're going in for a well child check and you're going to one of those 10 clinics, please give us feedback on how it's going and whether or not your child enjoyed the book. And that program will last for a year, but that's another one of those opportunities. Because of the implementation of the Affordable Care Act, the Medical Foundation have been doing a tremendous amount of their fundraising to support uncompensated care on the behalf of patients. Because more of that care is now being compensated through the Affordable Care Act, it's freed up resources and fundraising capacity on the part of the foundation. And so the foundation is interested in helping us sustain the program once the first year of grant funding is completed. So it's going to be a great collaboration for us. The pediatricians love to use this as a tool that's an icebreaker in their beginning discussion with families. There's so many different things that we could talk about, but I'd really like to leave some time where you have a chance to ask us your questions and give us a chance to have a conversation about this. So I'll stop there.
So I have many questions, but first we want to
give each of you an opportunity to ask yours. For the purpose of the recording, I will be repeating your questions, so who would like to ask something? Yes. Okay, so how do early childhood caregivers in neighborhoods connect and get information?
Excellent question. The in these targeted school catchment areas, the 15 that are on the piece of paper, we hope to have events that are actually focused at the school that are available for pre-kindergarten age children to participate in with their caregivers and their families. And so we will want to make sure that those invitations go out to all of our providers. In fact, just yesterday, I mailed list of all of the registered child care providers to the superintendents and principals for those elementary schools so that they can begin that work right now. We also hope to be able to post to the website for each of the school districts the same kind of information that's downloadable then for any family, and links to the website that you can go to where you can download the information in up to 10 different languages. So if you're serving children who are Russian speaking or Ukrainian or whatever, Korean or Chinese, it's going to be available for downloading off the internet.
Thank you. Another question.
First, I want to thank you very sincerely with great gratitude that you are doing what you're doing. Early learning is critical and has been known by public school teachers for many years as being what's necessary for success. Thank you so much. What I really want to know is, with this final acknowledgement of that being so important to the essential learning for students, what anticipation should we have for revision in assessment and accountability for those teachers who are formerly thought to be responsible for everything that outcomes were being held accountable?
I think maybe.
Oh,
this-
I can.
Okay.
That's something I talk about every day. It sounds like you might be a teacher or know them very well. Yeah. Yeah. This is a fundamental debate of our day. I think certainly in the profession, and it should be for the nation. I think it's fair to ask schools and public services to be accountable for the tax dollars we give them. It is fair. But I think it can be misdirected with the idea of using assessment results to evaluate or hold individual teachers accountable. It's problematic on multiple levels, but it comes from a sense of urgency about this problem. The fact that too many kids aren't doing as well in school early and later. We're not producing, as a nation, as a state, as a county, the kind of graduates and the numbers of graduates we're going to need, thus the 40-40-20 goal. So it comes from that sense of urgency. And then from there, depending on whose hands these policy levers land in, you get all kinds of ideas. As a superintendent and working directly with teachers and having been one all my life, you have to approach this from a couple of premises. Obviously, accountability measures, holding teachers accountable for test scores, merit pay are two of the more popular levers people are trying to pull. They're founded on a couple premises. Number one, the first one, your question, if you believe that teachers are withholding their best practices, sort of keeping their A game in the bag, and all they need is an evaluation tool to scare them into doing better, then you're probably going to believe it's going to be effective. The same with merit pay. If you believe that teachers are not coming to work doing their best because they're holding out for something, and if you just dangle some carrots, they're going to do better, that's a premise you could build from. Or you could conclude that these people are doing the best job that they know how to do, and what they need is constant, sustained support and professional development to meet the challenges of our new age, and you might come at it a different way. I won't say where I fall along there, but that's my answer.
Well, I would just like to add to that in that, you know, there's a lot of recognition that folks are doing their best with what they know, but oftentimes we don't know enough of the pieces, as you were illustrating with this child care provider who's looking for what's the right things that I need to be doing with the children who are in my care. The same thing is happening in pre-kindergarten programs and in families. And so what we're trying to do through the work of the Hub is to make sure that we're sharing as much of that information and techniques and tools that are evidence-based and tried and true, that all of those different partners can be using to help children be as ready as possible. When my kids started elementary school, I mean, it was like, you know, just make sure they can tie their shoes and that they're potty trained. Well, we're in a totally different day now. And, you know, I know that I would have been marked down for their not being ready for their approaches to learning side of this evaluation. I can just confess right here. But I would have done the best if somebody would have simply shared with me what were the right things that I could do in order to have them be ready. And that's what we're trying to do, is to really share that information. And we're connecting those kindergarten teachers with their preschool teachers and with the child care providers as a part of this networking, so that folks aren't surprised. You know, maybe it's only at birthday parties where people are ever happily surprised. And so we're trying to make sure that people are aware and enabled to be able to do their best.
I saw a question right here. Yes.
We know that early parent education professionals are about the lowest paid in the community. And is there some funding that's going to go to higher pay and compensation for the people working with our youngest children? Or is it just the standards?
Okay, then to summarize that question, we know that early childhood educators are low on the pay scale. Is something in plan to help change that?
There's a plan that's been developed in a grant that the state has been awarded by the U.S. Department of Education called the Race to the Top Early Learning Challenge Grant. It's called the Quality Rating Information System. And it comes with a set of training tools that, through our local resource and referral child care resource centers, information is being shared with all of our child care providers across the entire state, that's giving them information that they can use to assess where they're at, what they can do to increase their qualifications, supplemental training that they can take. And when they do that and when they achieve higher levels, then their reimbursement, if they're providing care for children in the state's reimbursement mechanism, they'll be eligible for better reimbursement rates. And so we're hoping that with those incentives, and also with access to either free or very low cost supplemental tools, that we'll be able to have more of our child care community improve both their qualifications and compensation.
Thank you. I saw a question over here. Got it answered? Another one? Yes. Okay, question is, explain the approaches to learning column on assessments for kindergartners.
This is an area where national research, even international research, has shown that children who know how to better manage their own behavior, to do simple things like follow instructions, wait their turn, actively listen. There's a number of different skills that if they enter kindergarten already having those skills, the ability to delay gratification, that they are more likely to be successful in their learning experiences. And the approaches to learning is actually an assessment that's done by the teacher at the end of the first month of kindergarten based on that instructor's observation of how the child has functioned in the classroom. So it's not actually a test that's given to the child, it's more the assessment judgment of the instructor.
So I have a question. Marion County received the first hub contract given in the state of Oregon, and I understand that there are now 4 more. How is the money flowing differently than it did in the past, and how will you determine what programs to fund?
Most of the funding is not flowing differently.
Okay.
Most of the funding is still traveling. Very little of it actually comes through the hub. I mean, most of the funding is in the hands of our partners. That 120 million, 99% of that is funding that's in other parts of our delivery system. And the small amount of funding that comes through the hub is actually the money that helps support the Healthy Families home visiting program. And those funds will basically stay the same. We're working on contracts as we speak with the Family Building Blocks provider, who's been Marion County's provider for home visiting for many, many years. And so that we expect to stay basically unchanged.
Okay.
What's going to be different, though, is how we work with our partners on their planning for how they use funds and how we work collectively when there's opportunity for new funds. An example of that is there's an opportunity right now for additional pre-kindergarten slots funded through the state's OPK program. And earlier this week, we brought all of our pre-kindergarten providers in Marion County, we have 3 of them, to the same table to talk about where are our needs and what are our plans and how can we most effectively deploy those resources to cover needs in places like Woodburn that have this tremendous need for their 4-year-olds.
Okay. And Commissioner Carlson, I understand from our league advocates in the state legislature that you have been a force, not just in Marion County, but in helping to make some of these changes happen across the state. What do you think is going to be different?
So I was just going to add to what Margie said. Well, let me just say, first of all, that the amount of money that goes through the hub is so small relative to the work that needs to be done. And as I mentioned earlier, I serve on the board of the Coordinated Care Organization, and their amount of administration, I think, is close to $1 million a month. And it's only 7% of the total money that gets spent for Medicaid. So for them, it just feels like a little bit because it's under 7%. And Margie, I don't know what yours is. I'm more familiar with another county that I've been working with, but it's in like the $100,000 a year range, right? I mean,
Yes.
right.
Very skinny.
Right, very small. And so the amount of staff is, you have one executive director, you have probably some contracts with a few other organizations that help do work, but it's a very small amount to do a very big job. So the issue really is, and this was the same issue that was faced by counties when there was local commissions on children and families. Although I must say what's very different about this is the connection to schools. There was not that strong connection to schools, which is another reason why I think that this system has more likelihood for improvement. But if the dollars aren't going actually through the hub, then there needs to be either some written agreements, which I was going to mention in the application. All of the different partners were required to sign a written agreement. It's not legally binding, but it does express the intent and the goodwill of that organization to work together. But really, when push comes to shove on change, most of the time people want change, but they want someone else to change. So I'm doing things really well, but things need to change, so you need to change the way you're doing things. And if everyone does that, then nothing changes. So I think the real challenges are going to happen when you get to a place where there is, so for example, in determining how data is collected in the early childhood programs, because the kindergarten assessment is really the post-test for early learning. It's the pre-test at the K through 12 level, but it's the post-test for all of the 0 to 6 programs. And as we start working backwards and saying, so what are the stepping stones for us to get to better behavior in the classroom, but in kindergarten, more letter recognition and recognition of numbers and those early math skills, how do we get there? And Head Start uses one way to measure that, and Healthy Start uses a different way to measure that, and the Public Health Department uses yet a third way to measure that. We're going to be in the same apples, oranges, pears, and bananas place that we've been for these last 20 years in just not knowing. The other piece that we've had a lot of difficulty with is just knowing how many kids we're talking about, because there is no data system currently that allows you to look at an unduplicated number of children. So Department of Education has a database where early intervention, early childhood special education, and Head Start puts their data. The Health Department and Healthy Start put their data in a totally different database, and then other nonprofits put them in their own databases too. So the data collection piece is going to be critical for us to know whether or not we're making progress. So those are all things that I think are on the to-do list, and I know Margie probably in those meetings that she went to up in Portland had some discussions about where the state can help, where the local hubs are expected to do some things on their own. But I guess my words of wisdom would be that there are some things that need to be local, but we also don't need to reinvent the wheel 16 times to get some of these things done across the state.
Thank you. I see a question back here.
My question is about parent education. It seems to me like you need to get to a lot of the parents of like 0 to 3-year-olds to get them going on, teaching their kids some skills early on. And a lot of these people don't have any contact with any agencies. They parent may be working and they may be taking their child to a neighbor or to a relative for daycare, and we're not putting them in preschool. So what are you thinking, you need to do to catch these early parents?
What,
So to summarize that question, what are you doing for parent education for those 0 to 3, especially isolated parents?
So the Oregon Community Foundation has done some wonderful work in creating what they're calling parenting hubs, parent education hubs. And Polk County has had the benefit of that, and the city of Silverton has had also a parenting hub program. But we expect, we've got our fingers crossed, to hear positive news from the Oregon Community Foundation on a grant request that we submitted the middle of May for the coming year, actually the coming 3 years, to put in place coordinated parenting education, both developing more entities who can provide parenting education and more services to parents so that it's more of a community norm for folks to participate in parent education services all across the county. So we absolutely hear and could not agree more about how important that is for early engagement of families around healthy relationships and positive parenting experiences.
Question here. Oh, yes, please go ahead.
And I just wanted to add that at Marion County, we are actually connecting with the nurses that do work with the families early on. We send out information to pediatricians of all the services that we do offer at the clinic so that they can refer them as well. We're just brainstorming today about going into the hospital and providing them with information on different programs that we offer there at Children's Behavioral Health. So we're trying to just send a lot of information out in the community to reach everyone.
I have 2 questions, if I may. The first one is related to the business community, and you've identified that we have a partnership with the Chamber of Commerce, and I have had conversations with folks in the Chamber about how are you investing in early childhood care and education, because they have great plans for working with high school students and getting them ready to work, but they were a little bit confused about what their role is going to be with early childhood education, at least a couple folks that I visited with. So I'm wondering if you have a better vision of what you think the business community is doing as partners in this.
Okay, so for the benefit of taping, to summarize that question, what are you doing to reach the business community, and what can the business community do to assist with early learning?
Ryan Albritton, who is the president of the Chamber of Commerce, has just joined the Early Learning Hub's board of directors, And he's very much committed to it because his wife is an early learning professional. So we are in active conversation with the Chamber about ways in which they can support the work. As it was mentioned by Commissioner Carlson, we have already in place agreements with each of our different partners in a memorandum of understanding. But we're in the process of revising those for the coming years so that we get much more tangible and detailed about what we hope from the Hub to offer to them as a partner, and then what we think are assets that they can offer back to their partners across early learning to benefit the broader community. And so we'll be doing that with our schools, with our pre-K programs, our home visiting programs, our child care providers, and all of those key partners, as well as community groups. So we'd love to have one with the League of Women Voters too.
And let me just add, I think that people who are in the business community, many of them serve on boards of nonprofits. They're involved with early learning services. A lot of them are involved in service clubs, Rotary, that type of thing. And I know many years ago when we were starting to work on the Children and Families Commission, I talked to a person with Rotary and they said, just tell us what you want us to do and we'll be happy to do it. So those arrows that I had on that slide, it's not just the government and nonprofit services that need to align. Businesses also need us to give them some good ideas about what the direction is that they can do and how they can best help. But my experience working with businesses is they're very concrete. I mean, they don't want to sit in a room and do a whole lot of process stuff. They just want, here, give me the task or tell me to raise money for something, or, and if you need eyeglasses, we'll get eyeglasses. Just tell us what you need to do. So I think there needs to be an analysis of what the strengths are of the various, because business is not a monolith either. There's a lot of small businesses, there's larger businesses. Maybe it's the gift of time to let people off of work for an hour to go volunteer or to read to a child or whatever. So there's a lot of things I think that are untapped in the business community that we can go for.
And I think one of the important things that we're going to be looking to our business partners to help us with is a broad community outreach program. We really need to raise the awareness of our entire community about how important early childhood is and effective strategies that every family can use in which to create a healthier start for their child as
So-
they start.
I see a question back here. So do children in foster care receive special assistance or special attention in this program?
DHS is a very active partner. The Department of Human Services is a very active partner in the work of the Early Learning Hub and many of its collaborative action teams. And along with that, they're engaged not just on behalf of foster care, but also the children who are served in TANF and the supplemental nutrition programs, and they're full spectrum. We hope to be doing to put in place a tool that allows us to map back all of the early learning experiences children have had, and then link that to their kindergarten assessment scores and their third grade reading and math scores, so that we can start to connect the dots to say which children and what types of services have benefited to improve their education the most, and where do we have the places where we really need to look at either further supplements or program changes to make the services more effective. And we're fortunate, the Willamette ESD has already got some wonderful data warehouse tools that they've got in place for K-12 and beyond, but we haven't connected that previously to the early learning site, so that's the next avenue to pursue.
And I wanted to tag on if I could. So it's a great question, and not every child that's involved with the child welfare system is in foster care. So I just wanted to make that point. There are children who family might be concerned about or someone calls, but they're able to remain in their own home with supports. And then there is a new process that's being developed right now called differential response, where a child might not even rise to the level where there's a judge or a court that's involved, and DHS would be involved in helping connect that family back to community resources. We've been having some discussions at the state level about differential response, and we think that it's one of the areas where it's most ripe, I guess, for connection back to the Early Learning Hub, because they are going to be the ones that are cataloging, inventorying, identifying all of the services that are available for families, whether it be through the Parenting Hub or other services, and can help that family connect in. So I think on all levels, children in foster care all the way to children that there might be particularly neglect. I think that's where one of the things that you hear is that families who neglect their children, now alcohol and drugs could play a role in it, but in some instances where it's simply a matter of poverty and the family doesn't have the resources, it doesn't make sense to pull that child out of home, because when they put the child back into the home, they still don't have the resources to help with their child. And in that instance, connecting that family in and giving them the support that they need makes the most sense, and the Early Learning Hub can help with that.
So to summarize, I'm going to ask each of you to look into your crystal ball. 5 years from now, you are the first of 16 early learning hubs across the state. In 5 years, what do you see will be substantially different in Marion County than we now have? Let's just go down the row.
Oh, goodness. Well, I would say in 5 years, I would hope that we have expanded capacity for young children, so that any family that wants a parenting class, any family that wants a quality child care provider can find one, and that we are seeing definite results where more and more children are arriving at school ready to learn and ready to read.
I agree. I think that's what I see. The number of students participating in what we would call a meaningful pre-K experience, ready to learn. I would also predict that the level of collaboration between traditional pre-K providers and the district and other community partners would be very strong, very visible.
I would like to see just an increase in infant toddler mental health awareness, more providers providing services to families at all levels, and just families being more connected through just simple play and good physical touch that doesn't cost anything, and to see that in all the children.
I hope to see happier families, happier children, and a healthier and happier connected early learning system, where people really are feeling that we've come a long ways. We're not at the final destination yet, but people are feeling more optimistic and more engaged, because they see many ways in which they can be involved in ways that are going to benefit their children and their community. And we look forward to working with all of you to help achieve that.
Thank you all very much. The League of Women Voters of Oregon Education Fund has voted to study children at risk, and as part of that, we'll be looking at the rollout of all 16 of those hubs across the state, knowing that each of those areas is different. And we look forward to continuing to see what happens here in Marion County. We'll come back and visit this one in a few more years. Thank you all for coming tonight.
Thank you.